Hi there everybody. In this video what I'm going to do is go over with you a really quick and easy home rehab program for your shoulder. One of the biggest problems that happens if you look at videos on YouTube or certain exercises that may be prescribed by your various healthcare professionals for shoulders is a lot of times what happens is they start introducing strengthening exercises prematurely when first you need to work on helping to eliminate pain and inflammation. And so the way that we design our rehabilitation programs at our clinic for our patients is our first step of the program is working to help reduce pain and inflammation in those areas. And two of the primary exercises that we prescribe are very effective for helping to do that. The first one that we use is what we call a wand exercise. So basically you just get a dowel, you can do this with a broom handle or anything like that. And really what you're going to do, it's a very simple exercise but it gets really good results, is the affected shoulder, so let's say it's my left here, is going to be completely passive throughout this exercise. It's not going to be doing any movement at all. The right hand or the right arm is going to be doing the movement. So basically you're going to grab the dowel or the broom handle at one end with the active hand, and then the passive hand is basically just going to place the palm of the hand at the edge of the dowel or the wand. And basically what this right arm is going to do is passively move that left shoulder through different ranges of motion. And for people that have various limitations in range of motion in the shoulder, this exercise does a really good job of helping to stretch some of those muscles and ligaments, and it really does a great job of helping to reduce a lot of the pain and inflammation by simply helping improve movement. Movement is a really good thing for a lot of chronic overuse type shoulder issues, impingement, chronic rotator cuff problems, things like that. So we start off with those wand exercises. Typically what we'll do is have patients spend around 10 to 15 minutes each evening doing wand exercises like so. The other exercise that we do as well is what we call Conman's arm swings, or just arm swing exercises. And basically what we'll typically recommend is taking a 2.5 to a 5 pound weight and holding it in the affected shoulder side. And basically what you'll do is you'll lean over a kitchen counter, lean over a table anytime, hold that weight in your arm. If you don't have weights, you can use a half gallon milk jug halfway full of water, or fill it all the way depending upon how much weight you want in there. Basically you're going to hold it and you're going to swing that arm and keep it really nice and small circles, and you're going to swing it clockwise and counterclockwise. And what that's going to do, that weight is going to help traction on that shoulder. It's going to help stretch some of those ligaments, and that shoulder capsule is going to help improve movement and motion again, and that's really going to help reduce a lot of the pain and inflammation that gets in there in that shoulder. So those are the first two exercises that we recommend for patients. And again, with the arm swings, we usually will recommend spending another 10 minutes on that each evening. And so combining those, that's the first phase. The wand exercises and the arm swings is the first phase of exercises. Those do a fantastic job of helping to reduce a lot of that pain and inflammation. In addition to that, we do a lot of care here in our clinic consisting of chiropractic manipulation as well as some other in-office active stretching techniques that we will do with the patient. But then once we kind of get to that place where they're feeling a lot better as far as pain relief, inflammation has gone down, then we start introducing strengthening as part of that. And typically what we recommend is just using TheraBand. You can purchase this online for $10, $15. It's pretty simple, straightforward, not very high tech. But as you see here, this has got a door hanger in it, so basically we just open the door and we get that locked into the door like so. And so basically these exercises are going to be, there's going to be 3 exercises that we do for the strengthening component of this. First is going to be external rotation, as you see here. The key to this is just making sure you keep that elbow nice and pinned to the side. And what you see here is what you get, just doing simple external rotation. And typically we recommend anywhere from 10 to 15 repetitions, 3 to 4 sets. This doesn't really need to be a lot of intense training. It's just enough to help facilitate and improve the strength and stabilization of those external rotators of the rotator cuff. Namely, you're typically using what's called your infraspinatus and your teres minor muscle right back there in the shoulder. So that is your external rotation. Then assuming we're going to switch shoulders just for sake of showing you, then the other one is going to be internal rotation. Same sort of thing there, you notice. Just making sure you keep that elbow nice and pinned in. And do these nice and slow. Typically what we say is around a 5-second count. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Nice and slow. Somewhere in there, I should say 3 to 5 seconds is typically where we're going there. Nice and slow there. And then the final exercise, so that's going to be working your internal rotators, okay? So primarily teres major and subscapularis is part of the rotator cuff muscle. That may or may not matter to you. And then the final exercise, this one is critical, and this one is often an overlooked one. This is going to exercise and help strengthen a muscle in your rotator cuff known as your supraspinatus. And this one's pretty critical for helping with proper shoulder stability and stabilization. And so basically, you see how I've got the band here. You just step on it with one foot, okay? So some shoulder exercises would have you just straight do abduction like that. That's not what we want to do, because what that's primarily working is the deltoid, and that's not going to be helpful. What we want is we want to move that shoulder from straight out like that, about 20 degrees forward, what we call scaption plane, okay? And what you're going to do is you're going to bend that thumb down, and you're going to lift right to about 90 degrees. You see how we're bringing that right out just like that. So it's not straight out to the side, it's not straight forward, it's about 20 degrees out, bring it up just like that. And again, with these, again the same, 10 to 12 repetitions, 3 to 4 sets. So all in all, when you get into the strengthening component, you're going to do those 3 exercises: external rotation, internal rotation, and exercising that supraspinatus. They call that an empty can maneuver. Okay, so you have 2 phases of care here for shoulder rehabilitation. First phase, pain relief and pain care. Second phase, strengthening and stabilization. That is a very comprehensive, very good, straightforward shoulder home exercise rehab course that you can use to help with any sort of pain that you might be experiencing in your shoulders. Again, this shouldn't replace seeing a chiropractic physician for your issues that you might have. If you do have shoulder issues and you haven't seen a chiropractor before, it's a good idea to at least have somebody involved with this process with you. So, if you have any questions, feel free to contact our clinic. We'd love to help you out however we can. Thanks again.